What we noticed several years ago, call volume was increasing, and it was repeat calls for non-emergency. And then we noticed that it was the same people calling. So it was an indication that there was something else going on. They had some greater need, and all they knew to do was to call 911. So we sat down with each of these different residents. At the time, it was about 6 of them, and just had a conversation. Because once we were able to build a level of trust with them, then they were able to share more about what's really going on in their life. And then we were able to see that they had things that were way beyond 911.
So once we identified these needs in our community, we had to figure out how we were going to address them. So we looked at several programs, but one of the main programs we found was a community paramedicine program, which is relatively new, however, is starting to become more frequent across the country. And the unique thing about a community paramedicine program is one size does not fit all. So you basically base the community paramedicine program in your community off the community's needs. And the one area we thought that our community needed to address the most was the elderly population. So then we tailored our community paramedicine program to that population. And what a community paramedicine program will provide is, it will provide preventative care ahead of time, maybe keeping those patients from, or those citizens from having to call 911, when indeed it could just be a visit where we could, fall-proof a house, check vital signs, connect with local community partners and get them equipment they may need, like for fall prevention or lift assist devices, things of that nature, where 911 then is not called at all. And we're taking care of our citizens without taxing the healthcare system, without taxing the 911 system. And that's, we felt, was our best bet to try to care for our citizens, but also by reducing cost to our citizens and our taxpayers by not having fire trucks and ambulances responding on every call, because with that becomes an inherent cost and an inherent risk, while also assisting in the overall healthcare system of not bringing non-emergent patients to hospitals who are already overwhelmed due to COVID, due to understaffing. So overall, we felt this would improve our entire system and enhance our community. Another benefit of the program is that one-on-one connection you have with a resident. We're able to provide them with resources that maybe they couldn't afford or didn't even know existed.
So an example would be, we had a 68-year-old gentleman that fell 119 times in just a little over 9 months. We went in to investigate what was really going on. And it turns out that he had had multiple strokes maybe about 20, 30 years ago, but that left him very debilitated. And whenever he would fall, he couldn't get up, couldn't turn over, and so he would press this panic button. Once we got a chance to sit down, talk to him, gain his trust, we realized that what he needed was his own lift device. He lives by himself. He does have a caregiver that comes in every day, but that caregiver is not around him 24 hours. We got him connected to Disability Link. They provided the financing. We did the research for his own self-lift, and they financed the whole thing. That's just an example of getting someone connected with what they really needed, and that reduced the number of calls from 119 to about 19.